If you look at a pro athlete, I have some people who come to me and they don't have diseases or disorders, but they want to improve their performance. They want to perform at a higher level. In order to be the greatest you can be, you need to be in the game. In order to stay in the game, you have to be able to have longevity. In order to have longevity, you have to be able to recover. The greatest are the ones who know how to recover. Recall, memory, even physical performance is much better when you've had proper sleep. So we use sleep to help bring out the greatness that people have locked in, help unleash that greatness.
We try to see everybody within an hour. I think one of the things that I'm committed to at Sun City is that patients don't need to wait in general for their care. So we have a policy here that we do everything within our power to see patients who have a problem within 24 to 48 hours. So the patients need to know that we're doing everything within our power to see everybody as efficiently and as quickly as possible without compromising our time with the patient and the care of the patient.
So Christina, we are now, it feels like we have entered a different world almost. It is very calm, the lights are dim, there's various colors throughout the room, and it feels very peaceful in here. So tell me a little bit about the room that we're in.
So this is our spirituality room. Centro San Vicente prides itself on providing care that is holistic, that is mindful, that is spiritual. All of that combined, we have a complete package of healthcare, right? And so we want to be able to offer a place where patients can come and decompress. And this is the room where we could do that in. This room allows for patients to come in here either before an appointment, after an appointment, or they might not need an appointment at all. If they just want to come in and sit in the calmness of this room, we encourage that. So not only will you see patients here to be able to sit and reconnect with who they are, we also have employees that do that because frankly, we know that life is hard, right? We're in economic stress, and maybe we're food insecure, maybe we're having issues with transportation. But allowing yourself to come in here and reconnect with yourself so that we can go back into the world and be healthier, then that's what we are aiming to do here at Centro San Vicente.
Great day would probably be, seeing my full schedule of patients, and of course, you can't control the outcomes of some things, but a great day is giving great news to patients and have the patient satisfaction in receiving the good news and knowing that they're well taken care of, that their chronic medical illnesses are well controlled, all their preventive services are met, and that there's somebody that they can count on for an acute problem, for their chronic care, that will always be there for them, and will try their absolute best to keep them happy, healthy, and safe.
This is one of the pieces of memorabilia I have. Most of the people or the things I have in here, I've actually met the person. I did not meet either one of these. I'm a Texas X, so I have my little UT section. I've met most of the people in the Texas section. So both those swim caps, the left side with the orange horns is Will Lacone. He's an El Paso kid, swam for Texas, third in the trials. He actually was Big 12 Athlete of the Year, which is huge because he beat out basketball, football, track for the whole Big 12, which is really huge. The guy next to him is also a patient, McBroom. Didn't grow up here, but he works here.
coming in for a wellness visit is vitally important for my patients. I think prevention is better than cure. So you want to come in when you're feeling well to make sure that everything is well. And the wellness exam consists of several things. It consists of taking a history, doing a comprehensive head-to-toe examination, talking about your vaccination status to make sure that you're up to date with all your vaccines for your age and your gender, and talking about cancer prevention screening. So things like mammogram, pap smear, a PSA for men, a colonoscopy or a stool test to make sure that you are not at risk for colon cancer. We would also do some blood work and some urine tests, talk about all the things that you can do in general to stay well.
And then you also have a special 3D X-ray machine as well?
Yes, CBCT. So what that is basically a CT scan of your neck and above. So that's where we use to assess possible tumors, or sinus issues, deviated septums, and definitely the airway for the sleep apnea. So if there's a narrow airway, we can assess you probably have sleep apnea, and then we ask them the questions, and then we're trying to get that adjusted to open that up so they can breathe better, feel better, enjoy life more.
Nice. So this X-ray machine, it kind of gives you more views of their throat, mouth,
oh yes,
and not just the teeth, right?
Yes. So I've found tumors in patients where I referred and saved a couple people's lives because of having that technology. So it's very gratifying when you can help someone like that.
We're going to go into a different session of mental disorders. I am going to talk a little bit about anxiety and what we call the anxiety spectrum disorders. Anxiety also makes a huge impact in our lives. Again, resulting in a lot of days lost from work, especially if people have panic attacks associated with that anxiety. I mean, people have had patients who have panic attack at work and the rest of the day is ruined. Anxiety is actually a little bit more difficult to treat than depression, especially with medication. It requires even a much higher dose of medication to get treated. Now, I said initially anxiety spectrum disorder. There's a whole spectrum of anxiety disorders ranging from just the generalized anxiety to obsessive compulsive disorder, and even PTSD is an anxiety disorder.
So we have a version of our supports that we recommend to a majority of our patients. So one of them is we call medical grade insoles. They look just like this. They run between $30 and $50, and they work in about 80% of the people. Okay, the advantage of these is that they're very affordable. They can go anywhere between $30 and $50, somewhere in that price range. So they're very affordable. We recommend them a lot. Now, if your insurance covers it, or if you're able to go a next level higher, the best thing I can offer you is a custom molded orthotic. So this is different. So this specifically made for your foot. When we do, a big advantage of us doing your orthotic is we put your foot in the correct position. We make the molding of your foot. If you go to many other places, they actually put the deformity into the impression. So guess what? You're not getting any control. And so that's one of the things that this one does. We use a company called Soul Supports, which I'm very proud to be associated with. And they give you the most maximal control of any orthotic I've seen in 31 years.
We offer many services to a patient to alleviate their pain. I see the patient, evaluate them. Sometimes we take x-rays as a diagnostic testing, or use ultrasound to see what the problem is. And sometimes we have to refer them out to get MRI or different sophisticated imaging. And once we have those imaging, then we can offer services such as injections, epidural injections, with fluoroscopic guided injection, sometimes with ultrasound, which is simple injections, We also do plasma-rich platelets and bone marrow aspirate. That's also more advanced. Arthritis in the knee, hip, shoulders, things like that. So there's many tools we have in our bag to treat patients, sometimes very minor tools, sometimes more sophisticated.
We provide for our patients different services from the wellness annual exam, where depending on the age of the patient, is going to include different screening tools. Usually blood work to check on cholesterol, glucose, liver, kidney function, etc. If the patient is healthy and is not taking any medications, that will be yearly. If the patient has high cholesterol, high blood pressure, diabetes, etc., we're going to be doing those labs a little bit more frequently to monitor medication, if everything is working correctly and if everything is under control.
The healthiest diet from cardiovascular health are both the Mediterranean diet and the DASH diet. They're very similar. The bottom line is you have to try to select for your nutrition meals and foods that are fairly not processed and high in fiber, and fruits, vegetables, and beans, lentils, raw meat, chicken, fish. And that's how you can actually treat hypertension and prevent cardiovascular problems and prolong life, theoretically. There's no guarantee, but you try to do that. So we can always give you details about what the DASH diet and the Mediterranean diets are for, but basically as we have my yogurt, you know, this is very low carbs. I'm gonna have it here. Very low carbs, along with fruits. Those are non-processed, along with oatmeal, non-processed, with some extra fiber to prevent absorption of a carbohydrate like the chia seed. And that's what I do. And these are the best. Nuts, mixed nuts. To me, they're a very high source of protein.
So one of my sort of de facto areas of specialty is the shoulder. Part of that is because I trained in San Antonio with 2 or 3 of the world's best shoulder surgeons. And so I came to El Paso with a level of expertise in the shoulder that other doctors just didn't have. So kind of one of the ways you know you're a specialist is other orthopedic surgeons send that body part to you. They don't want to deal with it. So I've always had an expertise in the shoulder that has ranged from sports injuries like labral injuries and labral tears, all the way up to rotator cuff injuries, all the way up to shoulder replacement. So shoulder pain is like, if I had to pick one area that I comprehensively treat everything in that particular body part, it would be the shoulder. One of the most common things I see is, of course, just shoulder pain, which falls into multiple areas like rotator cuff syndrome. One of the most highly underdiagnosed things that I see that cause shoulder pain is something called adhesive capsulitis or frozen shoulder.